I've got, don't have all my tools available in front of me.
Well, thank you. I appreciate you making time.
All right. Okay, let me call up the info here. Okay, so this is now 3:16 on Wednesday, September 23rd. And this is an emergency meeting of the Boulder County Board of Health to discuss Public Health Order 2020-07. Can I ask the board members attending to announce themselves? I'm Greg Thomas, President.
This is Jorge de Santiago, Vice President.
Morgan McMillan, board member.
Brooke Harrison, board member.
Okay, and that's so 4 board members. And how about staff that are attending? Please announce your name and title.
Jeff Zayak, Boulder County Public Health Executive Director, and I'll help us facilitate this. I'll go next to Tammy.
Tammy Golden, Business Operations Manager.
Next to Indira.
Indira Gujral, Communicable Disease and Emergency Management Division Manager.
Next to Kate Haywood.
Kate Haywood here with the Boulder County Attorney's Office.
Next to Rita. Is our organizer, is Rita on the phone?
I'm here, yes. Rita Mangan, Administrative Assistant.
Thank you. Next is Susan Motika.
Hi, Susan Motika, Strategic Initiatives Director.
Next is Lexi Nolan.
Lexi Nolan, Deputy Director.
Next is Trina Rulin.
Trina Rulin, Boulder County Attorney's Office.
Dr. Urbina.
Hi, Chris Urbina here. I'm actually in the dental office right now. I'm the medical officer for Boulder County Public Health.
And is there any other staff that I missed?
Megan Hatton, I think. Did you introduce her, Jeff?
I just jumped on, Jeff. This is
Okay,
Megan.
Great. All right, thanks.
Okay, thanks everybody. So we do have a quorum present. And this emergency meeting of Boulder County Board of Health has been called to order at the discretion of Executive Director Jeff Zayak. It's been posted on the Board of Health's website as required by law and had the necessary info to be able to attend the meeting due to COVID-19 and the need for social distancing to be in compliance with the order. This is being held telephonically. Okay, go ahead, Jeff.
All right, thank you, board members. I'm going to share a screen with here in a second with you. So we today are bringing you a public health order for approval. And we're doing that because I'm going to go through the data that we're seeing, but we're seeing a significant spike in cases that are surging associated with the University of Colorado, and specifically 18 to 22-year-old students. So I'll walk you through that data. At this point, we're concerned enough that we want to make sure that we're controlling the spread, that we feel like the addition of an order is going to be important. Even though we've put forth a letter for a 14-day self-quarantine, we're still seeing some behaviors on the Hill that are occurring, although better, that are still concerning us about spread of this virus. And because of the large number of cases specifically that we've been seeing in the last week, we feel like this order is prudent and important to move forward with. The order that you're going to see in front of you today has been reviewed by the Colorado Department of Public Health and Environment and is endorsed by them, as well as the governor's office at the state. And we've also had the order reviewed by the city of Boulder, who is a support for us in enforcement in the order that you're going to see, as well as the University of Colorado. And we're going to talk about how the three agencies are working together in this process to support the enforcement of this order as we move forward. The intention is clearly to stop. We have two major focuses. We've set up a area command system, and there's two major focuses that are overriding goals for us. The first goal is to stop the spread of this disease, and the second goal is to contain the spread so that it doesn't get to the broader community. And I'll talk about both of those as we go forward here. I'm going to go through the slides first. We're up to, and this data is from yesterday, we're up to 3,900 cases at this point. And you can see in the graphs that I've showed you before, this is the metro region. You can see that we have escalating case rates that are significantly higher than anywhere else in the region. And it's significantly higher than any of the peaks that we had before in the outbreaks that we were seeing. So obviously a significant challenge for us, and one that we're taking very seriously, and which is why we have an order in front of you today. Next slide is, again, just another way to look at our numbers here. These are residents that have tested positive. Again, you can see the two previous spikes here, and then the significant spike that we're on now. We're above 200 cases on one of the days, and that obviously is stretching our system on multiple ends. This graph is important, and it's going to relate to the next two graphs. What you see here is in the light blue. Those are CU students that are considered probable or positive today, and in the dark blue on the bottom is non-CU students. So if we extended this out back into early July, you would see that our cases of non-CU students are staying pretty consistent. So we're not seeing spikes in our general population, but we are being driven right now by this outbreak in CU students, which you can see here.
Hey, Jeff.
Yeah.
Question of clarification. The non-CU students, does that include CU staff among that general population number, or is it anyone affiliated with CU adults or students?
It is. I'll ask the question once more, Morgan, just to make sure I have it right.
Sorry. So I know that there have been a limited number of CU affiliated staff who have also tested positive. Are they included in the dark blue or the light blue?
They would be considered in the dark blue. These are just CU students.
Okay, thanks.
And the next slide is going to demonstrate this even a little bit more. So these next two slides actually. So the first one is the trend in 2-week cumulative incidence in Boulder County by age group. And the age groups are looking from 0 to 9 all the way to 30 plus. Clearly what we're seeing here is a large spike in the 18 to 22 group as a total, and the 18 to 19 specifically. And you can see on the bottom down here, I don't know if you can see if this is in the way. On the bottom here, we're not seeing a spike in other age groups outside of these two at this point in the outbreak. This slide includes non-CU students. So if you look at this graph again, 18 to 22 is the category that we're seeing the greatest spike in, 18 to 19 specifically, and non-CU students in this category are still very flat down here. So another indication that so far as of yet, we're not seeing a significant spread that is transitioning to the community, either to our at-risk population or to other age populations outside of these. These are the two primary populations that we're most concerned about. And obviously, we are watching this very closely because of the number of students that we have. We don't want to see community spread occurring. And again, that's why we're coming forward to you with an order today. The order is focused on the 18 to 22-year-old category, specifically because of this data that we're seeing. I just want to highlight the other indicators for us that are important that I always want to talk about, and that's our percent positivity rate. This was as of 8/1. Our 5-day average was 3.5. Our 5-day current, and I think this has been updated on the state's website. I was not able to pull it before I grabbed this, but we are above 4% now and less than 5%. So our positivity rate is climbing slowly. We have set up 2 different testing sites. I think you're all aware of this. The one site is at Stasio Ballfields, and we are seeing a little bit larger percentage of the general public in that site. And the other one is a walk-up site that's up on the hill, and we are seeing definitely a larger percentage of students on that site. We are continuing to encourage and will continue to encourage testing, especially at the walk-up site, for students that are off campus. The university, and I think Patrick O'Rourke is on the phone. I'll introduce him at the end here, but I think he will talk to you a little bit more about what they're doing on campus. But we are encouraging students that are off campus to go to that testing site, and students have been taking advantage of that and are testing at that site. In our area command, we are working to assure that that site is available until we see positivity rates at that site below 5%.
Can I ask a quick question about the students? Do they have to perform a saliva test first, or can they go to the walk-up site and go straight to the PCR test?
They can go to the walk-up site and go straight to the PCR test. And when it gets to the university portion, and I don't know if Patrick, if you're on the phone, if you want to just jump in and answer that question relative to on-site campus students, that would be great.
Jeff, if Patrick isn't there, I can answer it. This is Indira.
I'm not hearing him yet, so go ahead, Indira.
So the campus is doing a lot of proactive testing using a saliva-based test, and those that are living in the dorms are required to do that test weekly. And so that if they're positive, they go straight over to Wardenburg for confirmatory PCR testing. If they're symptomatic, they'll also be advised to go over to Wardenburg immediately for PCR testing.
Thank you. This next graph just indicates again that percent positivity rate. We can see that it stayed fairly low since our outbreak, and we do not want it to climb. So again, with testing, we want to be below the 5% when we look at those test sites as well, and make sure that we are testing adequately enough to make sure we've covered the disease that's in the community. So again, that is being worked through our area command system, and currently those sites are supported by the Colorado Department of Public Health and Environment, with operations support from our Office of Emergency Management and the University of Colorado. Just want to share our hospitalization rate as it compares to the state. So we're still very low in terms of hospitalization rate compared to the state and the nation. We obviously want to keep it that way. I'm going to go to the next slide, which shows our actual hospitalizations. So you can see that these have stayed fairly consistent and flat, and that's exactly what we want to see. We're also tracking indicators, as you've seen me present to you before, that are looking at med surge bed availability, the number of ICU beds that are being used, the number of ventilation units that are being used. We're tracking those things, and we're meeting with our hospitals on a weekly basis, so we're able to confirm what we're seeing in these charts as well. And that's my last slide. I'm going to see if there's questions on the data, and then what I want to do is move into the order itself. And I'm going to have Trina and Kate go through the order with us and review the components of the order, why we felt like those were important, and then what our intention is moving forward.
Can I ask one more question about CU? Do we know what the positivity rate is, dorms versus off campus? Is the spike being driven mostly by students in dorms?
Indira, do you know the answer to that?
Yeah, so early on, the spike seemed to be indicating off-campus positivity rates were higher. And then over time, it looked like during the Greek rush term that the rate seemed to increase in the dorms. And that is because a lot of students are, participating in these Greek life events, and then they go back to their dorms.
Got it. Thank you.
All right. Well, so we drafted the order to focus on a couple different things, and I'm going to turn it pretty quickly here over to Kate and Trina. And I think you all know Kate and Trina, but they are our county attorneys. They've been working with us on this outbreak and have been just absolutely incredible support and have helped us really get to where we are today in a whole host of things, not just the order itself, but in all kinds of associated things with following regulations and making sure we have good guidance. So they're invaluable to us, and I want to thank them each time I get the chance to do that because they've been incredible. So thanks to both of you. I don't know who's gonna take it on first, but I'll turn it over to lay out what the scope of the order is that we're looking at and some of the components. And then we can talk some more after they've completed that. And I stopped sharing. There we go.
Perfect. I don't have anything to share, but I believe the board members were provided with a draft proposed order prior to this meeting and should all have that. So I will just summarize for you what the draft order says and the impacts that we expect it to have. And then I can answer any questions, and Kate can jump in if I miss something. So the draft proposed order has two components. First, and probably most importantly and most significantly, it is going to prohibit all gatherings within the city of Boulder among 18 to 22-year-olds or involving 18 to 22-year-olds. This means that 18 to 22-year-olds citywide within the city may not go out to socialize at all, whether indoors or outdoors, whether on or off campus. It also means they can't go out to eat together, and they can go to work. It does mean they can go to work. It does mean that they can go outside to exercise, but they just can't gather in groups at all, either with other 18 to 22-year-olds or with other members of the community for the reasons that Jeff identified before, that we want to prevent spread to the general community. The second part of this order is that we will issue a stay at home. The proposal is to issue a stay at home order to 36 specific addresses. These 36 addresses are all within what's called the Hill neighborhood within the city of Boulder. They were identified through two mechanisms. First, they are Greek life fraternities and sororities with which, according to the epidemiology team, there have been a number of outbreaks associated. And second, they are properties at which we have had multiple violations or egregious violations of public health orders. For the properties to which we are going to address the stay-at-home order, we expect to have about 1,000 impacted residents of those properties subject to stay at home. Those people, those 1,000 people approximately who will be subject to stay at home, may not leave their property except for an essential activity. This will be substantially similar to the stay-at-home order issued by the state in March. That's actually the long and short of the order. There's a lot of intricacies to it. One thing I should mention, that with respect to the gathering prohibition, the way that this will impact the dorms is that students within the dorms should not gather in common spaces. That would be considered a gathering. We have taken into account the fact that some students may have roommates, and you can be in your room with your roommate, but if you go outside, you should stay separated. And this is for ease of messaging to everybody.
Can I ask, just what's the difference between not being able to gather for 18 to 22-year-olds and the stay-at-home order? What's the difference for those residents in the specific locations versus all 18 to 22-year-olds?
So if you are subject to a stay-at-home order, you may not go to work, you may not go outside to study, you may not go, let's say, to a store to just go peruse dresses or whatever you might be perusing at a store. If you're stay-at-home, you are stay-at-home. You can only go out for essential activities. If you are just in between the ages of 18 to 22, you may go outside and perform activities. You may go outside to study. You may go outside to eat alone. You may go outside to attend. Well, you can go outside basically for any reason you want, as long as you're alone. So that's the substantial difference there.
Got it. Thank you. We have included in the order a provision about voting. I just want to point that out.
For the stay-at-home order, we have defined voting as an essential activity because we know that students tend to vote in person in a larger percentage than the general public, in case that is a concern.
Other questions about the order? What I would
So-
like to do too is make sure I'll talk about, after you're done with the questions on the order, I'll talk about what we're doing in terms of partnership between our organizations and why that's so critical as we move forward.
I have a question, Jeff. This is Jorge de Santiago. And that's for regarding to that, how that's going to be enforced in terms of if they, those students pretty much, they don't care. It seems like it. But if they violate this order, is the police going to be enforcing? They're going to be ticketing, or what is the steps they're going to follow?
So by passing this order, it would actually have 3 separate mechanisms of enforcement. The first would be just the traditional Boulder County Public Health Authority to enforce, which so far in this pandemic, we have not relied on a whole lot because the city is in a much better position. The city, when we pass a public health order, the city under its emergency order has incorporated it into its municipal code. So any violation of a public health order would be a municipal violation, which their police force can enforce. We have been communicating and working with the Boulder Police Department and the CU Police Department around the enforcement issues. We know that most enforcement will most likely have to focus on the Hill area. And I don't want to speak for the police department, but that is being planned and addressed. And then the third prong of enforcement is through the university itself. And I think Pat could probably best speak to that.
And just for everybody so they know who Pat is, Pat O'Rourke is the Executive Vice Chancellor and Chief Operating Officer for the University of Colorado. And go ahead, Pat. And
so thank you. With respect to CU enforcement, this would be done through on the Hill area for CUPD. We have, in contrast to prior weeks, we have stepped up our disciplinary jurisdiction, and we are now, if any student has engaged in what would be a significant violation of a public health order, which would include things like hosting a party or being in a situation where somebody has violated isolation and quarantine, those students are subject to immediate interim suspensions pending the adjudication of their case, as well as would be subject from, once the case is adjudicated, if it is established that they have indeed engaged in that type of behavior, they would be subject to suspensions for the remainder of the academic term. As of yesterday, there had been 14 such interim suspensions that had been issued, and we are already seeing a significant effect on the student behavior by a shift of enforcement posture to bring it into compliance with the expectations of the county.
Great, thank you.
I have 2 questions. So work is not considered an essential activity then for any 18 to 22-year-olds? Is that correct?
No. So if you are at one of the 36 properties that is subject to the stay-at-home order, then work would not be considered an essential activity, or work would not be considered an essential activity. We have a provision in the order that says if you believe that this order will subject you to food or housing insecurity, you can contact Boulder County Public Health, and we can move from there to determine if it should be appropriately applied to you. But in general, for the 18 to 22-year-old population, the vast majority of which is just subject to the gathering restriction, they can go to work. The reason for this. The reason for the stay at home for those 1,000 residences or for those 1,000 people in those 36 residences is because that is where we have seen the bulk of the spread.
Okay, and is there a timeline on the order? I didn't see that, or is this an indefinite order?
No, this would just be, it's written for 14 days.
Thank you.
And this is Greg. So the bulk of these properties, I'm understanding, are Greek houses, but not all of them, obviously.
Yes, I believe 29 of the addresses are Greek houses, about 29, and then there's 7 that are not. It actually might be 30 are Greek houses and 6 are not Greek houses.
Okay. So heavily Greek houses. Okay,
Yep.
thank you.
In the other addresses that are not Greek houses, those addresses were placed on the list in coordination, collecting data from the city of Boulder, where those addresses have committed at least 2 public health order violations or at least 1 egregious public health order violation based on Boulder Police Department data.
Wait, can I ask what's the history of putting public health orders to a specific age demographic? Has this been done before?
That's an excellent question. I haven't researched nationwide or statewide, really. I'm not aware of it. It is new and novel, but we vetted it and we feel confident that this is a narrowly tailored approach that will address the spread.
Morgan, I would just add that CDPHE, Dr. Rachel Hurley, was pretty heavily involved in those conversations and felt like the order based on the data that we're seeing made very much sense to them.
And actually, I will add that we do have official approval from CDPHE as well as from the governor's office in agreement that this is a good approach to this surge.
So to your knowledge, other university towns haven't done anything similar? This would be novel?
I don't know if it would be novel. Honestly, I haven't had the time to research exactly the contours of the orders in other university towns.
Yeah, makes sense. Thanks.
Sorry, one other question about,
data. Sorry about that. I mean, I think the data screams 18 to 22, and then CU versus non-CU. So as much as it can be defended by the use of data, I think it's very apparent.
One more question about the specifics of the order limiting gatherings for exercise. I'm just thinking about if I were 19 years old and I've just been given a, limit on gatherings, which is challenging for someone in that age group. It's challenging for any of us, but particularly for someone in that age group. And then, one way of sort of getting out and supporting my isolation or combating my feelings of isolation, certainly through exercise. So I'm just wondering about that. I understand the intention of keeping groups down, but.
Yes, exercise is permitted, both for the stay-at-home group and for general 18 to 22-year-olds. Exercise is explicitly permitted in the order.
You can do, but you have to exercise alone. Is that what the order says?
Correct.
Okay.
So it just doesn't, it means don't go to a gym class. You can go outside and run, bike, walk, etc.
But you can't hike with a friend. That's what
Correct.
Okay.
That would be considered a gathering.
So I guess, I mean, I raised that question. I don't know if it's, again, I respect where it's coming from, but just thinking about, are there any appropriate social outlets for this age group? And maybe the answer is no, for 2 weeks, and we see if it works.
Morgan, I know from my perspective, and I think Dr. Urbina is still on the phone, he can weigh in on this. We had a little bit of this conversation the other day, but with the numbers of the population that we're seeing, it feels pretty important to make sure we're trying to do what we can within the scope of the order that we have to limit any additional spread. It does make it a little bit easier from an enforcement perspective, but I'll defer to Dr. Urbina to add anything else that he wants to say relative to that gathering with more than one person.
Agreed. And I think, sorry about the mask, but the issue is stopping the infection. So what we're talking about is making sure that people are isolated, or not, excuse me, they're quarantined, obviously isolated if they're infected. So we're trying to, as much as we can, limit the spread of this infection. So the more restrictions we put on this age group, both at the stay-at-home as well as restricting activities to single people, we're going to decrease the spread of this infection. I know it sounds very aggressive, but I think at this point we have so many cases, we have to be fairly aggressive in our recommendations.
I hear that, and thank you for the follow-up. I mean, I agree, we need to be aggressive. It's just one of the things that stood out to me is like, ooh, that would be hard. But this is hard and calls for hard interventions. I hear that and I understand it.
I can see the 2 weeks being reasonable. Is there a possibility? So within that 2 weeks, we would also see if we have a more pronounced spread outside of CU, which we have not seen in the last 2-week period based on what you showed. Is there a possibility after this 2 weeks that this would be extended?
There is. So if we're continuing to see cases increase and we don't see a decline, then that indicates that we're still in you've heard me talk about R naught above 1. That indicates that we're still in a increasing, escalating case rate, and we would continue the order in that kind of scenario. And we would be talking about what other solutions would we be needing to think about as well if we did not see some indication that this was working.
And that would be if there was an increase still in the CU population, but not a commensurate, even without a commensurate increase in the non-CU population.
That's correct. And one of the reasons for that, I think you've all seen the dial that was released and the matrix that was released by the state. And we are in the category that we're in with our incidence rate alone puts us into stay at home in that dial. And we obviously don't want to remain there, not for the campus, nor do we want to remain there for any part of our community because it has significant implications on business, our economy, social issues. If we had to move to a stay-at-home order and it began to spread elsewhere, we don't want to get to that point. So we would definitely consider, in consultation with Dr. Urbina and with CDPHE at the state, we would be in consultation about what we should be looking at in terms of either further orders or extending the current order. The other thing I would mention is that we have 3 main groups that are meeting under the area command. One of those is enforcement, to look at how do we support the order, how do we make sure the order is working. They're working on defining metrics and then having those metrics reported back. These are behavioral metrics that would give us a better sense of, are we seeing changes on the Hill itself? So is there less number of parties? Is there less number of students out? Are we seeing masking or not? Are we getting complaints at the same level that we were before? Those kinds of things are being developed and monitored so that we can get reports back to the agency administrators group that is the policy group for this effort.
Hey, Jeff, this is Greg. So I'm guessing the population is pretty small, so, you can only do what you can do, but 18 to 22-year-old CU commuter students, they're not restricted at all, right?
I can answer that question.
Thanks.
Boulder County Public Health Authority only extends the jurisdiction of Boulder County, and specifically this order only extends within Boulder city limits. So any student that's outside city of Boulder limits, or any 18 through 22-year-old outside Boulder city limits, would not be subject to these gathering restrictions while they're outside city limits.
Including if they're current on-campus students. Right, because the on-campus students are not at stay-at-home. It's only the Hill properties that are stay-at-home.
Only the Hill properties are stay-at-home, but every 18 through 22-year-old within City of Boulder limits is subject to the gathering prohibition. So on-campus students, yeah.
Any other questions from
Anything
board
else that
members?
needs to be discussed?
I want to just make sure that I'm emphasizing the importance of the City of Boulder, CU, and BCPH in this process, because we all know, and I've said this a couple times now. I said it last night at the Boulder Valley School District Board of Education and in other places, but we know that this is going to come down to student behavior, and we know it's a difficult age group. We're hoping that this is going to work, and it also comes down to student behavior for this age group. We're hoping that the changes that the university has made in terms of their disciplinary action and some of the things you just heard us talk about will make a difference, but we can't be everywhere at every moment. And we know that it's going to come down, a lot of this is going to come down to the responsibility of those students. And we're hoping that this will shift this. As you heard Pat say, actually, I want to give him an opportunity to add anything else here, because we can't accomplish this, any one of us alone either. It's really important that we do work together and that we leverage our resources and figure out how we're going to make the most impact with a limited amount of resources. But I heard that through the disciplinary process, there's very few, if any, return disciplinary issues with students, and that was prior to and before the changes to this much more severe process that they currently have in place now. Pat, do you want to add anything else at this point?
Thanks for the opportunity, Jeff, and thank you to the board for allowing me to come. The first thing I want to do is acknowledge the fact that we aren't just looking at this as an issue for the public health department to be able to correct. We recognize that because our student population is in large part driving the infectivity numbers, that we need to partner with the county in order to be able to address it. And I greatly appreciate the fact that Jeff has been working so collaboratively with us in order to do that. We are in support of this order and recognize that it's something that we have to be in a position to affect the behaviors that are coming. As I described earlier, we have stepped this up from an enforcement posture in terms of what we're doing internally. We're also trying to figure out what we can do in order to be able to support our student population, because we are seeing this taking a toll on them from a mental health perspective, and we need to be in a position to be able to support them holistically as we move forward. We are committed to being in a position where we don't want CU's infectivity rate to lead to the situation that was described earlier, where it is causing a greater restriction to be placed upon the county residents or the city residents generally into tripping it into a stay-at-home order. We're increasing our own testing capacities to be able to better detect and address infection where it occurs, but I'm happy to answer any questions that you might have of CU, so that you understand what we're doing, as well as the impact on the broader population. I would note that, following up on what was described earlier, we know that this will be a burden on that 18 to 22-year-old population generally, and that there are enforcement issues that would have to go along with that. But we recognize the necessity of the moment. We're also hopeful that when it is announced that those particular properties are being placed into stay-at-home status, that step up in the county's leverage will have a resonating effect through our entire student population to help them continue to recognize the gravity of the situation that we're dealing with. So it's giving us some additional tools in our toolkit in order to be able to communicate with our community as well.
Can I ask one more question for the university? Are you all concerned that when you put this into effect, that residents of some of these 36 stay-at-home ordered residences will flee and try to move in with their friends that aren't under a stay-at-home order? I'm not sure how you would ever control for it, but I'm just curious.
Trina can probably address that better, but there are provisions within the stay-at-home order that create a process for them not to be able to vacate their premises in order to go couch surfing within the community. But we do anticipate that there will be some of them that might, particularly if they are from the Denver metro area, that would want to be able to return to, for example, if they had a home where they were living with their parents in Denver, and the order anticipates a process by which that could occur, and that for some of the sororities that have previously been subject to this type of order based upon their outbreak status, the department has worked collaboratively with them to actually facilitate that happening in an orderly manner.
Got it. Thank you.
I have nothing to add to that. Pat nailed it.
Do we know how many of the residents within those 36 houses have already contracted COVID?
That's a question that the EPI team may be able to answer. What I do know is that we have mapped the COVID outbreaks and COVID positive test hotspots, and there's substantial overlap that I'm aware of, but I don't know. I can't answer that question.
This is Indira. The outbreaks that we've identified have been significant, as Trina mentioned. Sometimes up to 10, 11 cases within a home. The problem with some of the houses is that the exposures someone can be in isolation because they're sick and then expose other members of the household who are then in quarantine. But that quarantine can be continually expanded until the number of cases actually decreases. And so we do feel comfortable with the outbreak data that we have, that helps to inform this public health order.
So in the city of Boulder, so order number 1, in the city of Boulder, you also have 18-year-old high school students. And so obviously, they're prevented from gathering, which, obviously probably does not include school. But anyway, I guess my main question is, based on the recent legal challenges that have so far been unsuccessful, do you anticipate an additional legal actions when we release this order?
I wish I had a crystal ball. Whenever any action is taken, I think it's safe to say that you can anticipate some people will disagree with the action. I don't have a crystal ball to say whether or not this would garner that kind of attention, but I am confident in its legal soundness. To address the high schoolers who might be 18 years old, there is a provision in the order that if you are 18, 19, 20, or 21 or 22 and are still going through a K through 12 school or participating in K through 12 activities, those activities are not considered gatherings. So this order will not prevent high schoolers from attending high school events.
Thank you.
If there's not other questions, the other thing I would like to ask the board for support on is that when we revisit the order in 2 weeks, that I have the authority to extend that order if necessary, so we don't have to call another order, or if we see something massive change during this process. So is the board, that would be the other thing I would ask for a vote on. Sorry, just to be clear, it would be to extend or amend the order.
Any other questions from the board members before we ask for a motion? Okay, not hearing any. Can somebody put forward a motion and mention the public health order and title, please?
Sure, this is Brooke Harrison. So I'll put forward a motion to approve the Public Health Order 2020-07, prohibiting gatherings involving persons aged between 18 and 22 years in the city of Boulder and stay at home for subject properties.
I second.
And thank you for that motion in the second, but do we also need to state that the department has the authority to extend without convening another board meeting? Or
And
if we do that,
and just before we, and I'm happy to support that. And I know that you do this anyway, Jeff, but just it would be great to continue to just get updates on how effective this is being. I'm just sensitive to that this is really hard and we have a really big problem, and I'm glad that we are going after it with an aggressive solution. But I just also want to be sensitive to, is this working? Do we need to brainstorm adjustments? Do we need to reconsider certain parts of it? And I know you are very sensitive and your team is very sensitive to those things. So I just want, because this is a public meeting on the record, I just want to say that it would be great to continue for the board to continue to monitor, is this resulting in the outcomes that we want it to? And if it's not, is the right solution to continue extending it as is, or should there be amendments made? And so, again, just throwing that out there.
Happy to do that.
And to Morgan's point, that's why I anticipated that we would split it into 2 votes. First, to approve the order, and then second, to approve the ability to amend and extend, just in case.
Okay, that's great. Okay, so we have a motion and a second for the approval of the public health order. All in favor?
Aye.
Okay, so that motion is adopted. And so now we need to discuss the what was just brought up by Morgan and Jeff. I mean, I guess I would say that would it be the board's desire to reconvene again in 12 or 13 days, look at the most recent data, and either extend at that time, just because this is fairly novel and will obviously garner a lot of attention in the media, or would we just, do we want to do that now, knowing that we will obviously be updated probably multiple times a week with the data that they collect?
Yeah, I agree. I would support amending the bill on the fly. However, I think it might be a good idea to meet again before there's an extension, and also re-review whatever the potentially amended form is.
And I mean, Jeff, weigh in here on, I don't want to slow down. You guys are working on this 24/7. And so I do respect the immense amount of work and data crunching you are constantly doing and strategizing. So I would like to hear your thoughts on, hey, it's just easier if we can extend this. We're going to keep you in the loop. I'm not close to that. But I just am thinking through, what's the appropriate role for the board here?
Sure. I think if I can make a suggestion based on the conversation, what I would do is request the ability to amend in the next 14 days if we have an issue that comes up that we need to deal with quickly. And then for extension, we can come back to you. How about that? And in the interim, we are doing daily reports that will be wrapped into our incident action reports, and I can cut that section out and send it to the board so you can see what the reports are relative to those behavioral metrics I was talking about.
That's great. I mean, I don't want to create an extra thing for you to do every day, Jeff. So if it makes sense to do it like after a week, please don't feel I don't need the data updates every single day, especially if it's one more thing for you to have to do. But I appreciate your saying, I mean, it makes more sense to me to say, yeah, if you need to amend it immediately in the next or anytime in the next 2 weeks, great. We want to give you the green light to be able to do that quickly. And then if the rest of the board is okay with let's revisit and extend order, then I think I would be supportive of that.
I think we would just
Any
need a
other
motion.
comments, questions from the board members? I mean, I think I like that plan.
I do too. This is Jorge.
Yeah, agreed. And I don't, weekly's fine. I don't need to burden you daily.
Thanks. I'll do weekly.
Okay, then I move to give the public health director the ability to amend the order within the next 2 weeks as needed.
I second.
Any additional discussion? Hearing none. All in favor? Aye.
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 Any opposed? Okay. A motion is adopted.
Well, I want to thank you all for making time on such short notice to come together and help us work through this. So thank you very much. We'll keep you updated. And unless there's anything else, Greg.
Okay, so it is now 4:09 and this emergency meeting of the Boulder County Board of Health is adjourned. Thank you, everybody.
Thank you.
Thanks.
Thank you. Bye.
Thank you.